An HIV diagnosis used to be a death sentence, and there may still be no cure, but it is now possible for those living with HIV to live long and healthy lives, and there are new methods of prevention. In tonight's Real Men Wear Gowns, Eyewitness News reporter Jeremy Baker explains the medical advancements surrounding the disease.
HIV was something that was very, very serious and sometimes fatal.
That happens when HIV kills your white blood cells and your immune system, advancing the disease to AIDS. But Dr. Barbara Taylor, an associate professor of infectious diseases at UT Health and staff physician with University Health System, says AIDS just doesn't have to happen anymore.
Now, when most of my patients are on one pill once a day, they can live long and very healthy lives.
The main ways people contract HIV are through unprotected sex, by birth, although that is rare since most mothers with HIV are on treatment, and by sharing injection drug needles. Prevention is also key to beating the epidemic. There is also medication you can take to reduce your chance of contracting HIV by over 90%. It's called PrEP. That stands for pre-exposure prophylaxis.
Most insurances cover PrEP, and if not, there are medication assistance programs that we can use to help defray the cost of PrEP.
HIV is well and alive in Bexar County. In 2006, there were 234 new cases. By 2015, 360. In Bexar County, the number of HIV cases per 100,000 people is 19.1, but across the U.S. much lower, with 12.3 cases for every 100,000 people. The first big step in stopping the spread of HIV is knowing your status.
Once you're tested, getting onto treatment will not only save your life, but will help us all as a community end the HIV epidemic.
In San Antonio, there are places that offer free HIV testing. We have the list on KENS5.com. Jeremy Baker, KENS 5 Eyewitness News.